Hello, let's begin. Today we are going to study about JVP. We will first learn the what is the thing, then get the trick for MCQs and then solve few MCQs to completely grasp the concept. So JVP stands for jugular venous pulse or jugular venous pressure. Okay, so this is the way. And let me tell you one thing: if you find JVP in any person, then means it is mainly associated to right heart failure, means right heart conditions. Okay, so these are the waves: A wave, C wave, X wave, no, X descent, Y descent, and V wave. So what does it signify? A stands for right atrial contraction, A contraction, X is relaxation. C stands for bulging of tricuspid valve into right atrium, means bulging of tricuspid valve. V stands for atrial filling and Y stands for atrial emptying. So A is contraction, X is relaxation, V is filling, and Y is emptying. And C stands for tricuspid bulge. And sometimes this A wave gets large cannon-like. Okay, so if it gets large cannon-like, that is a condition in which there is a complete AV nodal block. Complete AV nodal block or VT. VT stands for ventricular tachycardia. We will learn about the abnormalities. So this is the normal condition. A for right atrial contraction, C for tricuspid valve bulge, X stands for atrial relaxation, V stands for atrial filling, and Y stands for atrial empty. Okay. Now the abnormality. As I told you, in A wave, the cannon of giant, if the A wave is very large, it stands for complete AV block or VT. VT stands for ventricular tachycardia. And if it is prominent, it stands for pulmonary hypertension, right atrial mass, TS, and or RVH, right ventricular hypertrophy also. Means if it is prominent, it shows right ventricular hypertrophy, pulmonary hypertension. And if A wave is absent, it denotes AFib. AFib means atrial fibrillation. Now X descent. X descent, if it is absent, it will show severe TR. TR means tricuspid regurgitation. Regurgitation. Sorry for my pronunciation. And if in rapid, it's cardiac tamponade. If X descent is very rapid, means it happens very fast. Like this, the slope is very fast. This is the normal X descent, na? And if it happens very fast, rapid, then it will stand for CT. And if it is completely absent, means from C it goes to V and then Y, then it will stand for TR, tricuspid reject. I am not able to pronounce it. I don't know why. Yes, regurgitation. Tricuspid regurgitation. Now I got it. We were sorry for the stavel. We will, if it is dominant, it stands for again TR, and in Y descent, remember Y is just completely opposite of X. So in Y, if it is absent, it stands for CT, and if Y is rapid, it stands for TR. Okay. Now this is the trick. This was the normal concept. Okay. Now this is the trick. So see, mainly questions are asked on abnormalities. If it's a difficult level question. Okay. Now the trick table is for A wave, you must learn it. That if A wave is prominent, it will stand for pulmonary hypertension or RVH, right ventricular hypertrophy or pulmonary hypertension. And if A wave is very large, like cannon or giant, then it will stand for complete AV block or complete heart block or VT. VT stands for ventricular tachycardia. Okay. Now let us do about X and Y. This is where the confusion arises. As I told you, X and Y are completely opposite to each other. And how will you remember this? See, out of X and Y, which comes first? X comes first, okay. And out of A and R, which comes first? A comes first, okay. So like this, write X and on top of it write A. Means A for absent. So when X descent is absent, the condition produces severe TR, severe tricuspid regurgitation. And when it is rapid, it produces CT. What is CT? Cardiac tamponade. And in case of Y, it is completely the opposite. Write A on top, absent. And if it is absent, it will produce CT. And if it is rapid, it will produce TR. Like completely opposite of X. And What is, and let me tell you one more thing. CT has a common feature. The common features of cardiac tamponade are hypotension. Patient will produce with hypotension. Heart sounds will be muffled, is muffled heart sound, and generalized weakness, chest pain, like this. These are the symptoms of cardiac tamponade. Okay, cardiac means mainly the patient will present you with hypotension, and the heart sounds will be muffled and or weak like that. Okay, let us start doing the MCQ. You will be able to do all of them easily. So see the first question. A in JVP corresponds to. So let us do the. You can. This is very easy, but still for your purpose, I am drawing it again. This is the A wave. This is the C. This is the, sorry, A wave, C wave, X wave, V wave, Y wave. A C X B Y. So what A stands for? A stands for right atrial contraction. C stands for tricuspid bulge. X stands for, Y stands for, X stands for right atrial contraction. So X will be right atrial relaxation. Then again V stands for venous filling, and Y stands for empty. Simple. This is A wave in JVP corresponds to the first option, right atrial contraction. So closure of tricuspid valve, no. Onset of ventricular systole, no. Maximum atrial filling, no. The C wave seen in normal JVP waveform represents C. The C wave is T bulge. T bulge means tricuspid valve bulge into the right atrium. So let us see. Bulging of tricuspid valve into the right atrium. Yes, this is the correct one. So this one also atrial relaxation during atrial diastole, no. Venous filling of the right atrium. See, venous filling of the right atrium, this represents V wave. Emptying of the right atrium, emptying, this represents Y descent. Okay, then let's move on to the third question. The following abnormality on a JVP waveform can be seen in which of the given conditions? Let us see the waveform. See, this is A C X V Y A C X V Y A. See, this is a huge A. So, in which condition you see a huge wave? Okay, let us study A wave. Huge means cannon. So, in which conditions we got cannon A wave? When there is a complete AV block, or VT. VT means ventricular tachycardia. These are cannon. And in which cases this A wave is prominent? RVS or pulmonary hypertension. And in which case A wave is absent? AFib. Okay. So in this condition you can see A wave is raised up much. Means it is a giant condition. So with either AV block, complete AV block, or VT. Cardiac component no, tricuspid regurgitation. Tricuspid no, AFib no, ventricular tachycardia VT. So this is the option. Question 4. A 37-year-old male patient comes to the clinic with complaints of weakness, restlessness, chest pain. Okay. On examination, his blood pressure is found to be 90/60. Hypotension, clearly seen. Okay. His heart sounds are muffled. Heart sound muffled. And his neck veins are distant. Neck veins are distant. What is the typical JVP findings in this patient? Okay, so as the conditions we can see, hypotension it is there, heart sounds are muffled, and neck veins are distended, and a generalized chest pain. Is all referred to CT, cardiac tamponade. Okay, now see this is a hard level question now. Like, is CT given? No, CT is not given in the question. Now they have given us the options we refer which can lead to CT. Absent AOF, no. This leads to a fib. Prominent AOF, no. This leads to RVH or pulmonary hypertension. Let's see, rapid Y descent and absent Y descent. Now you might get confused. What to do between X and Y? So the trick I gave you, write X first and then Y. As X comes first, draw two. So what comes first? A or R? So A, write R. With A, you can write absent, and with R, you can write rapid. Similarly, write this same thing. And in this case, X is absent in severe TR. Okay, this is the thing to remember. And if you just remember this, X absent in severe TR, then everything is done. Because X is rapid in CT and Y rapid, it will be opposite of this. So TR and absent in CT. So see, X wave is not given, only Y waves are given, rapid or absent, absent in CT, absent, absent. The D. See, I had shown you this trick I told you. So done. This is also done. This was a good MC. You needed to first find out this cardiac component and then this. Okay. Deep Y descent in JVP in seen in all except. Okay. Deep Y descent. So again, X, A, R, A stands for TR, C stands for CT, Y, A, R, A stands for what? A will be opposite CT, and rapid will stands for TR. So see, deep Y descent. Deep Y descent means rapid. Okay? Seen in all except rapid. Try to read. It is seen in this. Yes. Constructive pericarditis is also it is seen because TR plus C. Constructive pericarditis it is also seen. No, cardiac tamponade, not in cardiac tamponade. In cardiac tamponade, deep Y descent. No. In cardiac tamponade, Y is absent. It's seen in all except this. So this is the answer. These are the MCQs. Thank you. So just remember this trick table and these are the concepts and then JVP will be done. Thank you.